Anand Shushruth, your presentation on that podium, and Anshuman, this podium. Yeah. You have a 6 minutes time slot. Please stick to your time slot because marks will be based on the time slot also. The hall in charge. Can we have a pencil or a pen?
So should I start? Amit sir.
So Anand, we start with the presentation.
Yeah. Respected dignitaries and my dear colleagues. First of all, I would like to thank Jharkhand Ophthalmic Society and Team AIC for selecting me and giving me this opportunity. Now I would be presenting my report on kindergarten vision screening for early detection and management of amblyopia. Just a little bit of background for the study. There are two studies. The first study states the prevalence and determinants of refractive errors among school children of 7 to 15-year age group. The prevalence of amblyopia is around 1.52%. And the second study is a study of awareness about the need of early vision screening in a set of proven cases of amblyopia. It's a questionnaire-based study. What this study has seen that parents were ignorant about amblyopia and the need of early vision screening. The class teachers were the first person who suspect about visual problems in most of the cases. It was also noted that pediatricians were unaware about the amblyopia and the need for vision screening. Now, aims and objective of the study. By conventional school screening program, we can detect amblyopia only after the age of 6 to 7 years. The monitored occlusion treatment of amblyopia study, that is the MOTA study, showed that improvement after amblyopia therapy is significantly low among children older than 6 years and compared to those who are younger than 4 years of age. So plan was to detect amblyopia early, that is in the age group of 3 to 4 years, for the effective management. Now plan of action. The management of all schools of the town were convinced for a need to eye examination at the age of 3 to 4 years. On specified day, a team comprising of one ophthalmologist, one senior optometrist, and 2 vision technicians went to the specified school. Only a bunch of 50 kids were examined in a day, and children found to have low vision were marked, and teachers were informed and advised to convey to the parents of such children to have an eye checkup at the hospital. We also sent for the children who were diagnosed to have any refractive error, deviation, or any other ocular ailment. A letter was also sent from our side to their parents to explain regarding the severity of the ailment, and were advised to meet the doctor at the base hospital for proper treatment. On coming to the hospital, firstly, all children were examined by the ophthalmologist for any deviation in ocular pathology. Then cycloplegic refraction was done for every kid. Refractive correction was done and spectacles were prescribed. Those having anisometropia, corrective lenses were prescribed, and need and technique of patching explained to the parents. This is a schematic presentation of the plan of action. Now coming to the results. We did the screening in 6 schools. School 1, there were 38 children. School 2, we had 40 children. In school 3, it was 45. In school 4, 38. School 5, 47. And school 6, 46. Total of 256 students were examined. And out of that, 25 had that refractive error. Out of the 25, bilateral refractive error was in 19. Anisometropia was in 6 children, and squint was diagnosed in 3. This bar diagram shows the refractive error of total 25, bilateral refractive error 19, as well as anisometropia in 6. So all this is the flow chart. showing 256 children. Amblyogenic students were 28 28. That is around 10% of the total, 10.9% of the total children examined. Refractive error was in 25. That is 9.8% of the total of the amblyogenic percentage, and as well as the squint in 3 children. That is 1.2% of the total children examined. Bilateral refractive error was found in 19. That is 7.4% of the total children, and anisometropia was in 6 children. That is 2.3%. Thanks a lot. And finally, I would like to thank you all, as well as the